This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today. Welcome to the Global Men's Wellness. I'm Dr. Judson Brandeis, and I'm so glad you're here. In this series, we explore the cutting-edge treatments, overlooked issues, and groundbreaking innovations that shape the future of men's health. Today, we're focusing on an issue that may not grab headlines but deserves your full attention: microhematuria. Let's start with a scenario. You go for a routine checkup. Your doctor runs some labs and then says, "There's blood in your urine, but you can't see it." You feel fine. You shrug. It's probably nothing, right? Here's the problem. It might be nothing, but it also might be something. Microhematuria, defined as having 3 or more red blood cells per high-power field on microscopic examination of a properly collected urine specimen, affects a significant portion of the adult population. It's not visible to the naked eye and is often discovered during routine testing. But what many people don't know is that it could be an early warning sign of serious conditions, including bladder or kidney cancer. Let's break this down. Part 1. What is microhematuria? Think of your urinary system like the plumbing in a house. Normally, the pipes, your kidneys, ureters, bladder, and urethra, carry waste fluid without any leaks. Blood in the urine indicates a leak somewhere in that system. And when it's microscopic, it's silent. You can't see it, feel it, or detect it without a lab test. Part 2. How does it work? Your kidneys filter your blood. If the filtration system or anywhere downstream becomes irritated, inflamed, or disrupted, whether from a tumor, a stone, infection, or trauma, red blood cells can slip into the urine. In some cases, the blood might originate from the bladder lining itself, especially in smokers or people exposed to industrial chemicals. Part 3. Is it new? Is it proven? The guidelines for microhematuria have evolved. The American Urological Association, AUA, and the Society of Urodynamics, Female Pelvic Medicine and Urogenital Reconstruction, SUFU, released an updated evidence-based guideline in 2025. This guideline outlines risk-based evaluation, tailored approaches based on age, sex, smoking history, and degree of microscopic bleeding. It's a scientific framework designed to balance early cancer detection with avoiding unnecessary tests. Part 4. Why don't more people know about this? There's a big gap between guideline and practice. Studies show fewer than 10% of patients with hematuria are referred to a urologist. Women and African American patients are even less likely to be evaluated properly. Many clinicians misattribute hematuria to urinary tract infections or menstrual blood and fail to follow up. The result? Delays in diagnosing cancers that could have been caught earlier. Part 5. What do patients experience? The actual testing is relatively simple. It starts with urinalysis and includes risk stratification. If you're low risk, you may just need monitoring. If you're intermediate or high risk, you'll undergo cystoscopy and imaging such as ultrasound or CT urography. It's non-invasive, outpatient, and crucial for early intervention. Most men tolerate it well, and it could save your life. Part 6. Personalized urologic care. One-size-fits-all medicine is outdated. My approach focuses on understanding your personal risk factors, your age, lifestyle, history, and values. We use precision diagnostics to identify whether that microscopic blood is harmless or the start of something more serious. Whether it's ruling out cancer, managing benign prostatic hyperplasia, or optimizing urinary health as you age, the path is customized for you. Part 7. How effective is it? Risk-based evaluation works. In validated studies, patients categorized as low risk had nearly 0 malignancy rates, while those in high-risk groups had up to 6.3% incidence of urologic cancer. That's a powerful case for early screening in the right populations. When caught early, bladder and kidney cancers are highly treatable. Part 8. The future of urology. We're entering a new age in urology. Advances in AI, urine-based biomarkers, and telehealth are making diagnostics faster, more accurate, and more accessible. Personalized medicine isn't science fiction, it's science fact. Soon, risk calculators will integrate genetic data, environmental exposure, and even microbiome analysis to guide your care. Part 9. Why I do this work. I didn't become a urologist just to treat diseases. I became one to improve lives. I've seen too many patients suffer unnecessarily from delayed diagnoses that could have been avoided with a simple test. The silence of microhematuria is exactly why it's so dangerous. But the good news is, with awareness, evidence-based screening, and proactive care, we can catch issues early, treat them effectively, and help you live a longer, fuller, more vibrant life. So here's your call to action. Don't ignore subtle signals. Ask questions. Advocate for your health. Because there's a better way, and you deserve it. Thanks for listening to the Global Men's Wellness. I'm Dr. Judson Brandeis. Stay well, stay curious, and we'll see you next time. Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.